Stop scrolling for 1 second and look down at your hand. Right now, press one fingernail down firmly, hold it for 2 seconds, then let go and watch how fast the color comes back. That single 5-second test is something doctors use to check circulation, and depending on what you just saw, it may be telling you something about your heart that nobody has ever explained to you. Here's the problem. After the age of 60, cardiovascular issues rarely show up with a dramatic warning. There's no siren, there's no sudden collapse. Most of the time, the heart and blood vessels decline slowly and quietly, and the body compensates for it until one day it simply can't compensate anymore. By the time a major event happens, the underlying problem has often been building for years. What makes this especially frustrating is that the human body actually does give warning signs. They just don't show up where people are trained to look for them. They show up in a place almost nobody checks: the fingernails. Your nails are not just a cosmetic feature. They grow out of something called the nail matrix, a layer of living cells sitting just beneath the base of each nail. That matrix is fed directly by your bloodstream, and it's especially sensitive to oxygen levels, circulation quality, and the condition of the smallest blood vessels in your entire body. The capillaries under your nail bed are some of the tiniest vessels you have, and because they're so small, they're often the very first place that shows stress when your cardiovascular system starts to struggle. In your 30s and 40s, your body has enormous reserves, so it can hide dysfunction for a long time. After 60, that margin narrows. Not because anything is broken, but because decades of steady use naturally shrink the buffer the body has to hide problems in. Stick with me for the next few minutes because I'm going to walk you through 4 specific signs on your nails that have been linked in medical research to heart attack risk, stroke risk, and dangerous circulation problems. Every single one of them takes seconds to check, and you don't need any equipment. But pay close attention to the 4th one because it involves a part of the nail almost nobody has ever been told to look at. And it might be the most revealing of all 4. Let's start with the first sign, a color change called cyanosis. This is a bluish or purplish tint that shows up in the nail bed, usually most visible near the base of the nail. Most people have never been taught that there are actually 2 very different types of this color change, and knowing the difference completely changes how seriously you should take it. The first type is called peripheral cyanosis. This is when the bluish tint shows up only in your fingernails, maybe your toenails too, while your lips, tongue, and the inside of your mouth stay completely normal and pink. Peripheral cyanosis usually develops slowly over weeks or months. It's your body signaling that circulation to your extremities isn't what it used to be. It's a warning sign, not an emergency. The second type is central cyanosis, and this one is completely different. This is when the bluish color shows up not just on the nails, but also on the lips, tongue, and inside of the mouth. This is a medical emergency. It means the blood leaving your heart isn't carrying enough oxygen, and it needs immediate attention, not a wait-and-see approach. In both cases, what's happening underneath is the same basic problem. The tissue isn't getting enough oxygenated blood. With peripheral cyanosis, the issue is usually circulation. With central cyanosis, the issue is usually the heart or lungs themselves. Persistent peripheral cyanosis in the nail bed has been linked in research to early-stage heart failure, certain heart valve problems that can go unnoticed for years, and chronic lung conditions that eventually put strain on the heart. This matters enormously for anyone over 60 because heart failure becomes far more common with age, and it is one of the most frequently missed diagnoses in older adults. It doesn't usually announce itself with chest pain or collapse. It shows up as a slow, quiet decline that the body compensates for right up until it can't. So here's what to actually do with this. Look at your nails under natural daylight, ideally near a window, not under artificial light, which can distort color. Check the base of the nail bed. If it looks bluish or purplish and that color doesn't go away once your hands warm up, that's worth mentioning to your doctor. Ask specifically whether an echocardiogram would make sense given your age and any other risk factors you have. And if you ever notice a bluish tint on your lips or tongue along with your nails, don't wait for an appointment. That combination needs medical attention right away. Before we move to the second sign, think about this for a second. How many mornings have you looked at your hands and never once checked the color at the base of your nails? Keep that in mind because the next sign is one almost everyone over 60 dismisses as simply getting older, when it's often something else entirely. The second sign is brittle, slow-growing nails. This is nails that break easily, peel apart in layers, split vertically down their length, or just don't seem to grow the way they used to. Maybe you used to trim them every 2 weeks, and now they barely change from month to month. What's happening is that the nail matrix isn't getting the steady supply of nutrients and oxygen-rich blood it needs to keep producing healthy nail tissue. One of the most common reasons for that in older adults is a condition called peripheral artery disease. Peripheral artery disease happens when the arteries carrying blood to your arms, legs, and hands become narrowed by plaque buildup. And here's the part almost nobody explains clearly. The same type of plaque that causes heart attacks when it builds up in the arteries of the heart, and the same type that causes strokes when it builds up in the arteries leading to the brain, is the exact same kind of plaque that can build up in the arteries leading to your fingertips. If plaque is forming in one set of arteries, there's a strong chance it's forming in others too. That's why peripheral artery disease is considered one of the strongest predictors of future heart attacks and strokes. People diagnosed with it face a significantly higher risk of major cardiovascular events compared to people who don't have it. What makes this especially sneaky is that peripheral artery disease can stay completely silent for years, but there's a specific pattern of warning signs that, when they show up together, matters far more than any single one alone. That pattern is brittle, slow-growing nails, cold hands and feet that take a long time to warm back up, and a heaviness or cramping feeling in the legs when walking, especially uphill or upstairs, that goes away once you stop and rest. That last symptom has an actual clinical name: claudication. It's one of the most reliable indicators of significant narrowing in the arteries. If you notice all three of these together, brittle nails, cold extremities that stay cold, and leg cramping tied to walking distance that eases with rest, that combination genuinely deserves a conversation with your doctor. Ask specifically about something called an ankle brachial index test, or ABI. It's simple, painless, and non-invasive. It compares the blood pressure at your ankle to the blood pressure in your arm, and it can catch peripheral artery disease at a stage where treatment and lifestyle changes can make a massive difference. This test takes a few minutes in a doctor's office, and yet it's rarely ordered unless someone brings up the right combination of symptoms first. That's exactly why I want you to remember this pattern. Now for the third sign, and I want you to actually do this one with me right now, because it takes less than 5 seconds. This is called the capillary refill test. Hold your hand at roughly the level of your heart. Pick any fingernail, the index finger works well. Press down firmly on the nail with the thumb of your other hand for about 2 seconds. You'll see the nail bed turn white as blood is pushed out of the tiny capillaries underneath. Now let go and start counting. 1, 2, 3. Watch how fast the pink color returns. In a healthy adult with good circulation, that color should return in under 2 seconds. If it takes 3 seconds or longer, especially across multiple fingers, that's a sign the smallest blood vessels in your body aren't refilling the way they should. There's a second test worth doing right alongside this one. Press the back of your hand gently against your forehead or cheek. Your hand should feel close to the same temperature as your face. If your hands consistently feel noticeably cooler than the rest of your body, even in a warm room, that's another marker of reduced circulation in the extremities. Doing both tests together gives you a much clearer picture than either one alone. What's actually being measured here is how quickly your microvascular system, the network of your tiniest blood vessels, recovers from pressure. A slow refill means sluggish circulation in those small vessels. Research has linked persistently slow capillary refill in adults over 60 to a number of cardiovascular concerns, including reduced cardiac output, undiagnosed irregular heart rhythms, and elevated stroke risk. The smallest vessels tend to show trouble first, simply because they have far less reserve capacity than the larger arteries. One important caveat before you jump to conclusions: if your refill time is borderline, somewhere around 2 to 3 seconds, that alone usually isn't cause for alarm, especially if your hands are cold or you're on certain medications. Some blood pressure medications and beta blockers can slow capillary refill slightly without indicating any actual problem. Try the test again in a warm room with warm hands. If it's still consistently 3 seconds or longer across several fingers, that's when it becomes worth paying attention to. What makes this test so valuable is that it gives you real actionable information using nothing but your own hands. No equipment, no appointment, no waiting room. Just 5 seconds and decent lighting. So actually do it right now if you haven't already. Test at least 3 different fingers in a warm room with warm hands so cold temperature doesn't skew the result. If your refill consistently takes 3 seconds or more, write it down and bring it up at your next appointment. Ask specifically whether a cardiovascular evaluation, including an EKG and possibly an echocardiogram, would be appropriate. Now here's the fourth sign, the one I've been building toward because it's the one almost nobody has ever heard of. Look at the base of your nail just above the cuticle. Do you see a small whitish crescent shape, almost like a tiny half moon? That's called the lunula, and it's the visible portion of the nail matrix, the exact spot where new nail tissue is being formed in real time. It is one of the most overlooked diagnostic signals on the entire human body. Here's something almost nobody explains about the lunula. The pattern of which fingers show a visible lunula matters just as much as whether one is there at all. In a healthy adult, the thumb and index finger almost always show a clearly visible lunula. The middle finger usually does too. The ring finger sometimes does. The pinky often doesn't, and that's completely normal on its own. So if your pinky has no visible lunula but your other fingers do, that's not a concern by itself. What is worth paying attention to is when the pattern changes. When a lunula you used to be able to see on your thumb or index finger has disappeared. When lunulas across most or all of your fingers have become barely visible. Or when the color of the lunula shifts away from its normal pale white. And each color shift points in a different direction. A reddish lunula has been associated in some research with congestive heart failure and with certain conditions affecting the heart valves. A bluish lunula points toward the same oxygen and circulation problems we talked about earlier with cyanosis. A lunula that has faded almost completely into the rest of the nail can suggest anemia, which carries its own significant connection to cardiovascular strain. This sign earns the final spot because almost nobody is ever told to examine it. Most people have never looked at the base of their nails for anything beyond checking for an infection. And because of that, a visible signal that could prompt an important conversation with a doctor can go unnoticed for years. So take a moment right now, look at your thumbs and index fingers under good natural light. If the lunulas are entirely missing across most of your fingers, if they've clearly shrunk over the past few years, or if the color has changed, that is genuinely worth bringing up at your next appointment. Ask specifically for a complete blood count and a cardiovascular risk assessment. Now that all 4 signs are on the table, let's talk about what to actually do with this information, because knowing something and acting on it are 2 completely different things, and I want to close that gap for you right now. Start today. Take both hands to a window with good natural daylight. Examine each nail carefully. Note the color of the nail bed. Check for any bluish or purplish tint. Notice whether the nails feel brittle or look like they've been growing more slowly than usual. Do the capillary refill test on at least 3 fingers and actually time it. Look at the base of each nail for the lunula, and note which fingers show one and which don't. If you want to track changes over time, take a photo of both hands today. Gradual changes are genuinely hard to remember accurately from memory alone, and a photo gives you something concrete to compare against later. If anything we covered matches what you're seeing on your own hands, write it down. Note the specific sign, which finger showed it, and roughly how long you've noticed it. Bring that note with you to your next appointment. And within the next 30 days, if you notice 2 or more of these signs together, don't wait for your annual physical. Call your doctor's office, describe exactly what you've observed, and ask whether a quick phone triage could help determine if you need to be seen sooner rather than later. And one more thing that matters more than almost anything else in this entire video. Please don't diagnose yourself off of any single sign in isolation. What actually matters is the complete clinical picture, including your medical history, your current medications, any other symptoms you're experiencing, and what a doctor finds when they actually examine you in person. None of this is meant to replace that conversation. It's meant to make you a more informed participant in it. Here's what I want you to walk away with. Your body has been communicating with you for your entire life, sending signals every single day, some loud, some almost silent. Being over 60 doesn't mean meaningful health changes are off the table. If anything, it's the opposite. You have more context, more lived experience, and more access to support than at any other point in your life. And research consistently shows that early detection and informed attention to signals like these can dramatically change outcomes, even later in life. The nails you glanced at this morning and probably didn't think twice about maybe one of the most accessible diagnostic windows your body has ever given you. You just needed to know how to read them. Now you do. If someone you care about, a spouse, a sibling, a close friend, could benefit from knowing these 4 signs, this is worth passing along to them. The next person who sees this might be the one who notices something on their own hands tonight.